Hello, and thank you for joining us. My name is Lisa Schlager, and I am the Vice President of Public Policy for FORCE. Today, we're going to be talking about what's new in hereditary cancer public policy and the work that FORCE does on behalf of our community. So first and foremost, I want to familiarize you with our mission. We represent millions of people who and their families who are affected by hereditary cancers, and that includes individuals with cancer as well as those that are at increased risk due to an inherited genetic predisposition. FORCE programs really fall into four pillars: support, education, research, and then what we're talking about today, which is advocacy and public policy. These efforts revolve around legislative and regulatory work at the national and state levels, as well as efforts to influence medical guidelines and recommendations around cancer screening and treatment. So I wanted to start off by sharing a little bit about where you can find information about the work we do. If you were to go to the FORCE website, you can see there is a tab called Privacy, Policy, and Legal Issues. And on that site, if you click that top tab, you'll come to this page, which will share with you all of the current hot items that we're working on, as well as policy priorities, which you see highlighted here with the red arrow. This will give you an overview of our priorities for the coming year. Each year, we reevaluate what we're going to focus on, and we have shared that with you in this nice graphic where you can see that our top areas really focus on ensuring affordable access to care, as well as protecting genetic privacy and ensuring patient safety. Of course, FORCE always is focused on research. Only with research will we see improved early detection and treatment, or prevention for that matter. And then reducing health disparities has always been a central tenet of the work we do. So when we look at the genetic testing landscape, I think it's really important for us to know what is a quality genetic test and what is covered by insurance and what is medically recommended. Many members of our community are aware and have dabbled in ancestry kits and things that might share information about their potential risk for disease. We want to caution you that these tests are not medical grade. And while some of them might give you a first indication of a potential risk for hereditary cancer, it is not advisable that you rely on these for evidence-based and true medical grade care. So we want to make you aware that these only test for a small portion of the potential mutations that are out there. And we want to make you aware that they are not considered medical grade. So you would absolutely have to follow up with a healthcare provider and have confirmatory testing, even if it shows that you do have an inherited predisposition. The other thing to keep in mind is sometimes it flags things that aren't really significant medically. So again, we just advise caution. FORCE has a statement that we published around these types of tests, and you can find that in the advocacy section or the public policy section of our website. However, we do know that with those genetic tests and the broader uptake in genetic testing, more people are aware of their risk and more people have the ability to prevent or catch cancer early versus being diagnosed and having to treat. And we like to focus on that here. So what type of knowledge or information does that convey to a person who might carry a BRCA mutation or a PALB2 mutation or an MSH6 mutation? FORCE always turns to the NCCN guidelines, National Comprehensive Cancer Network, as the standard of care. They have the most comprehensive guidelines on how to manage the various risks that are associated with all of the different inherited genetic mutations that we find in our community. So just as an example, this is a snip of the recommendations for individuals who might have a BRCA mutation. And you can see here things like clinical breast exams starting at an earlier age, annual breast MRI, mammograms, tomosynthesis, which is 3D mammogram, as well as breast MRI, and even the option of risk-reducing mastectomy. It's important to know that many of the ages and types of screenings recommended for high-risk individuals are different than the ones recommended for those at average risk of cancer. And that plays into national guidelines as well as insurance coverage of the services needed by individuals who might have an increased risk. You can also see here the option of salpingo-oophorectomy, which is removal of the ovaries and tubes, potential options for screening for ovarian cancer, although we know that the evidence is lacking there. And then we also go into mutation management for men. Frequently, the focus is on women and breast cancer, but the reality is men also carry these mutations at equal rates, and they have equal increased risk of cancers in certain areas, depending on the type of mutation that they have. So we always advise folks to turn to NCCN guidelines, which Force does publish on our website under the section that focuses on hereditary cancer genes and risk. So you can always get the most current information. You can also go to the NCCN website and create your own account to access the most current guidelines. So those guidelines are focused on the high-risk community. However, the Affordable Care Act and the preventive services that it covers are focused on the average risk community or the general population. So under the Affordable Care Act, preventive services such as a mammogram, receiving a grade A or B from the U.S. Preventive Services Task Force, also known as the USPSTF, should be covered at zero out-of-pocket cost for the patient. That was a huge win for healthcare and the broader community, because for the first time ever, certain screenings are covered at no cost, which really makes it easier for everyone, regardless of their economic status, to take advantage of the recommended screenings for somebody who is considered average risk. So there are a number of services that do receive a grade A or B rating from the task force. And those include genetic counseling and testing for a BRCA mutation, but only for women. And it's important that it only focuses on BRCA mutations. So if you test for something other than a BRCA mutation, it may not be covered at 100%. In fact, it typically is not. Breast cancer screening, mammograms every 1 to 2 years, starting at age 40. We know that members of our community need breast cancer screening earlier. So that's not going to be covered typically at 100% until you reach age 40, and that would only be mammograms that are covered at 100%. Things like screening for cervical cancer are covered by the task force, as well as colonoscopies. And for people at increased risk of cancer, colonoscopies typically should begin before the general population. The task force just changed its guidelines to recommend starting screening at 45 for, quote, the average risk or general population. We know that that is not the case for people who are high risk. The other thing it recommends is only screening with a colonoscopy every 10 years. That doesn't work for a high-risk individual. So a lot of times the screening may not be covered in full, or you will incur out-of-pocket expenses if you need to start screening earlier or more frequently. So as I've provided an overview of, as we've talked here, is The task force guidelines do not address a lot of the screenings and interventions that are needed by people at increased risk of cancer. And that's because the task force's mission is really to guide primary care doctors, internists, people who do general care on what screenings their patients should be doing. And they aren't the ones who typically manage care for an individual who's high risk of cancer. So the services that are needed by high-risk individuals, either earlier or more frequently, are not addressed by the task force and therefore may not be covered at 100% as the services are under the Affordable Care Act that are recommended by the task force. So we know for private insurance, the majority of health plans do cover genetic testing. As we discussed, BRCA testing for women is required to be covered under the Affordable Care Act at 100%. However, we find more and more that doctors are ordering broader multi-gene panels, and then it's not covered at 100% because it's more than just testing for a BRCA mutation. We know this is the standard of care. Unfortunately, the task force has yet to update its guidelines to reflect this. So most people do see some out-of-pocket cost for their genetic testing unless they are only testing for a BRCA mutation. So things like Lynch syndrome, multi-gene panel testing, we are going to see out-of-pocket costs when you have private insurance, although those costs typically should not be excessive. And with private insurers, historically, there has been some resistance to testing men because the task force guidelines focus on women, but increasingly insurers are seeing the value in testing men because they are at increased risk of prostate cancer, pancreatic cancer, colorectal cancer, and so forth. So coverage and reimbursement under private health insurance plans for increased screening or risk-reducing surgeries is going to vary. Most insurers do cover things like earlier mammograms, breast MRIs, more frequent or earlier colonoscopies, but copays and deductibles and coinsurance apply. There are some states that require coverage with no cost sharing, but these are few and far between. So the states that cover or have specific laws requiring coverage of high-risk screenings are growing. And that's something FORCE is paying attention to. And we're starting to work on state-level advocacy efforts to increase the number of these laws that focus on ensuring that high-risk screenings are covered with minimal or no out-of-pocket costs. So for instance, we know that Washington, D.C., Connecticut, Pennsylvania, and New York require coverage of breast screening MRIs or ultrasounds for women considered to be at high risk of breast cancer. Some require no out-of-pocket cost and some require a cap, and some just say that the insurers have to, quote, cover it, but that doesn't mean that there's no cost to the patient. Colonoscopies in certain states are also covered for individuals at high risk, listed here, Alaska, Colorado, Connecticut, and so forth. And then for PSA screening, interestingly enough, the U.S. Preventive Services Task Force does not necessarily recommend screening for all men. They gave it a grade C, meaning that it's really up to the insurer to cover it if they choose, and it's up to the man and his physician to decide if he in fact wants to have that screening. I'll go on to add that high-risk men, absolutely, it is recommended that they have prostate cancer screening starting typically at age 40. But some states have enacted laws that say for men before the age of 50, you have to cover this. And we are working to expand our list of states that do offer this type of coverage so that we can start focusing our public policy efforts on state level legislation that will increase access and coverage to these high risk screenings. So What about people with Medicare? A large number of individuals are insured through Medicare in our country. And so Medicare is sort of unique. It's almost the opposite of what private insurers do. So Medicare will cover genetic testing only for people who've already been diagnosed with cancer. And this really flies in the face of prevention, but Medicare's mandate is not to prevent disease, but actually to manage the costs of chronic care. At least that's how it was set up in the 1960s. So if an individual finds out that they carry an inherited genetic mutation, access to the increased screening or risk-reducing surgeries is sort of variable. Officially, Medicare is not supposed to cover these, but we do find that some regions, individuals are able to get coverage for things like breast MRIs or a risk-reducing hysterectomy, and then in other areas, they're not. Definitely, there is no coverage for genetic testing unless you've had cancer, but we know that many people are able to access genetic testing at a very affordable cost these days. So we are seeing more and more people of Medicare age who know they have a mutation, and unfortunately Medicare is fighting them, uncovering the needed preventive or screening services. Medicare does cover certain services at 100% when it's provided by an authorized participating provider. And that includes mammograms, as well as screening for cervical cancer. They do cover prostate cancer screening starting at age 50. And interestingly, the only service that really focuses on high risk that Medicare covers at 100% is screening colonoscopies. Medicare does cover colonoscopies every 2 years for people who are considered high risk of colon cancer, and there's no minimum age. So that's actually a very positive policy there. Unfortunately, the rest of its policies do not reflect the needs of our high risk community. So that's why FORCE is spearheading a piece of federal legislation. The bill in the House is HR House Resolution 4110. And this legislation aims to modify the Medicare statutes to allow Medicare to cover genetic testing for people who either have a known mutation in the family or have a strong family history. And then if they test positive, it allows Medicare to cover the services that they need, whether it be increased screening or risk-reducing surgery, based on national guidelines. We are, working on getting support in Congress, and we certainly want to encourage all of our community to support this effort. And I'll share more about how you can do that later in this presentation. So what about people who either don't have insurance or they're underinsured? Well, we know that all but 2 state Medicaid programs now cover BRCA genetic testing, which is a wonderful thing. Only Alabama has no coverage. Rhode Island has partial coverage. Unfortunately, coverage of Lynch syndrome testing is less prevalent. About 80% of state Medicaid programs cover that. And if you're looking at something like a multi-gene panel test that would look for things like ATM or PALB2 mutations, unfortunately, less than a handful of states cover that at this point. We do know that in those states that do provide coverage, the screenings are covered, the high-risk screenings, and risk-reducing interventions typically are covered as well, but they vary by state. So it's very important to research what the policy is in your individual state if you are impacted by this. We also have the National Breast and Cervical Screening Program, and this program is federal, but it's implemented by the states, and it provides screening, breast screening and cervical screening for people who can't otherwise afford them. Unfortunately, only about a dozen states cover high-risk screenings, breast screenings, such as MRIs. So that is an area we're looking at as far as trying to expand access. We'd like to see the Centers for Disease Control, which oversees the program, to expand the minimum coverage to mandate that states actually have to cover high-risk breast screenings as well as just typical annual mammograms for women who qualify, because that access is so important in identifying cancers early when they're more easily treated. Let's see here. So out-of-pocket costs and access, that's really a big issue for our community. We did some surveys, and I'm sure many of you are not surprised to see that, unfortunately, breast MRIs are one of the most expensive screenings that our community needs, and it's quite challenging to access affordably for some. Some people pay up to $4,000 annually, and that is a big, big problem. And that is part of our impetus for working on public policy changes that can help control or eliminate those costs. The same goes for colonoscopies, unfortunately. Also very expensive and needed at least every 1 to 2 years by people with Lynch syndrome or other colorectal cancer syndromes. Again, a big issue for out-of-pocket costs. The insurers are not saying we won't cover these. They're just saying, oh, we're covering this, but it's considered, you know, an out-of-network provider, an out-of-network unessential, basically screening, and we're going to apply it to your deductible. So if you have an $8,000 deductible, you're going to be paying out of pocket every year, you know, with your co-pays and co-insurance to cover the cost of these screenings. So insurance, that's obviously the big question mark. It really comes into play for everybody in the US, but especially people who are at high risk of disease. So if you want to find information on what is covered or what has to be covered and what your rights are, this is where you go. Under support on the Force website, and then you'll see a section on insurance and paying for care. And that is where you should head to get more information. So once you're there, you'll see there are sections divided up by the types of services. So we have an overview. There's a section on genetic services, screening and prevention, treatment, clinical trials, and then a whole section on health insurance appeals. Under each of those sections, you're going to find subsections. And for instance, here under screening and prevention, we have a section on screening. We have a section on risk-reducing surgeries, also fertility preservation, and chemo prevention, something like tamoxifen. And under that, you'll have more information specifically on what private insurers are required to cover, what Medicaid and Medicare cover, and then where to go for financial assistance if you need it, and how to manage appeals if in fact you're having insurance coverage issues. So a lot of that feeds into the efforts that we make to engage in public policy on behalf of our population. Some of the big items in recent years have been access to free 3D mammograms for all women, and improving the guidelines, the national guidelines on screening preventive services that affect our community. We're also working really hard to control costs for screening and preventive services, as well as treatments, and working at the state level as well as the federal level to improve access to those affordable interventions. But we also engage in device safety, research funding, and even maintaining or strengthening the genetic privacy protections. I want to highlight a few big pieces of legislation we're supporting right now. HR 2144 or S 1450. Those are the bills in the House and Senate. We want to ensure that genetic counselors are approved providers under Medicare. Currently, they are not. So this is one of the bills we are highlighting in our grassroots engagement tool, and we would like to encourage you to support this effort. Everyone should have access to a genetic counselor if they need it or want it. Another effort is called the PALS Act. Initially enacted in 2015, it is important for us to reauthorize this legislation because the U.S. Preventive Services Task Force attempted to raise the minimum age for mammograms for the general population to from 40 to 50. And we think that's a terrible idea because we're going to miss a lot of cancers. And so this piece of legislation places a moratorium on those guidelines and keeps the minimum age at 40 for people who are considered average risk, and also ensures that 3D mammograms are covered as well as women in the armed forces. And again, I want to emphasize that this is for people who think they're average risk. We know that high-risk individuals have different requirements when it comes to screening. So again, to find information on these issues, you would go to the Force website under Privacy, Policy, and Legal Issues, and then click the Take Action Now button. And that is going to bring you to our CQ Grassroots Engagement Platform. So this is where you can take action and reach out to your elected officials and let them know how you feel about certain pieces of legislation. And you can see it looks very much like our regular Force website, but here you can click on an issue, take action now, and then it's going to take you to a place where you input your information. And I will say you have to include your address because that is the only way for them to know who your representatives are. They are more inclined to listen to their constituents. So, so you do have to share where you live, but once you complete that information, our system can save it if you choose to. And then it'll take you to a draft letter or email on this particular legislation. And what we've done is we've done our best to draft a convincing email. And you can see that it would highlight, it would make sure that your senators and elected congressperson are chosen to receive this. You would have the option to edit or add to this email if you have a personal story to share. But basically, we make it easy for you. If you like, you can just send it as is and tell them that you support this legislation, or in some cases, you oppose this legislation because it will either help or harm our community. And Force wants to help you, advocate and make sure that our community is represented in Congress. So another area you can see on this platform is the bills we're following. And these all somehow relate back to our community. And you can even see whether we support or oppose or we're monitoring that piece of legislation. These are bills we have our eyes on and may at some point have a call to action. Finally, yes, so if you were to click on one of those, you would see our position on this one is we are supportive of coverage of nipple tattoos for women who have had to have breast reconstruction. That is part of breast reconstruction in our mind. So yes, we are in favor and we are supporting that legislation. But for each of those pieces of legislation, you can see where we stand and what our position is, and even who the sponsors of that bill are in case you want to reach out. We also have a section that allows you to share with us. So in this particular case, we are collecting stories about people who have had issues getting Medicare to cover high-risk services. And if you choose to share your story, similar to when you send an email to your elected official, We'll ask for your information. And then you are going to have the opportunity to share your story. And once you complete sharing that story, it will be sent to us, and we will review that. And with that, we can reach out to you and see if your story might be used to help compel members of Congress to support certain pieces of legislation that we are advocating for. So I've covered a lot in regard to the types of work we do, how insurance coverage and national policies affect this. But I want to add in closing that we have a separate section on volunteering, a separate session. But we are looking for patient advocates to work with us in all 50 states. We historically have done a lot of work at the federal level, but we're trying to increase our presence and ability to advocate the state level because state policies are actually in some cases easier to get passed. And every step, every state that institutes a policy is one more state where our constituents have better access to care. So I want to thank you for joining us today. If you have any questions, here's my contact information. And I just want to say thank you for your interest. Only with dedicated, passionate people can we make a difference. And as you can tell, we at Force are very passionate about the work we do, but we need volunteers and people who are just as passionate to help us push for policies that benefit our community. So again, thank you, and don't hesitate if you have any questions to reach out. Have a good day.